Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been really struggling with my medications. There are so many bottles, and I'm not sure which ones are still necessary. It's just overwhelming.
I understand that can be quite confusing. Let's make sure we review all your medications today to clarify which ones you need to continue, adjust, or stop.
Thank you. That would help a lot. Also, I've been having trouble sleeping. I wake up several times a night, sweating a lot, and I can't go back to sleep easily.
I see. That sounds distressing. You mentioned using a CPAP machine. Are you finding it uncomfortable or difficult to use for the prescribed hours?
It's somewhat uncomfortable, and honestly, I sometimes avoid using it because it feels cumbersome. I'm only managing about 3 to 4 hours a night with it.
We'll definitely look into making it more comfortable for you. What about your emotional state lately?
It's been rough. I find myself crying at times, and I don't even know why. I think it might be related to my PTSD. I served in the military, and certain things just trigger these episodes out of nowhere.
I'm sorry to hear that. It's important we address these symptoms. Have you had any therapy or treatment for PTSD in the past?
Yes, a few years back I had some counseling. It helped a bit, but I stopped going. I thought I was okay, but now it seems like the symptoms are coming back, especially the sleep disturbances and emotional episodes.
That's useful to know. It's not uncommon for symptoms to reoccur, and getting consistent support could be beneficial. We'll discuss a referral to a behavioral health specialist.
I'd appreciate that. I've also been feeling dizzy lately, and my balance isn't what it used to be. Just the other day, I felt like the room was spinning.
Dizziness and balance issues can be quite concerning. We'll perform a detailed neurological assessment today to explore what might be causing these symptoms.
And I just don't have the energy I used to. I feel tired all the time, even when I get some sleep.
Fatigue can be caused by a variety of things, including your current health issues. We'll review all aspects today. Let's start with some updates on your health. How have your blood pressure and blood sugar been at home?
My wife helps me check my blood pressure at home. Recently, it's been around 110/70 millimeter Hg, but it dips sometimes, like it did today in your office. My home blood sugar readings have been pretty stable too, generally between 100 to 130 milligrams per deciliter.
Those are fairly good readings. Let's also discuss your diet and fluid intake, as they play a significant role in managing both blood pressure and sugar levels.
I've been drinking a lot of apple cider recently. I heard it was good for health, but I'm not sure if it's affecting me negatively.
we might need to adjust that, as too much of that could affect your hydration and possibly your kidney function. Let's plan to increase your water intake instead. Now, let's go over your physical exam findings and lab results to complete our assessment. Based on our discussion and your current symptoms, let's summarize the adjustments and plans we're going to implement. First, regarding your medications, we're going to simplify things. We'll stop the old prescriptions that are no longer needed and adjust some of the current ones to better suit your health needs. This should make managing them a lot easier.
That sounds good. It's been really hard keeping track of everything.
Absolutely. And we want to make sure everything you take is actually benefiting you. Now, about your sleep issues. The fact that you're using the CPAP machine for only 3 to 4 hours a night is something we need to address. We will get you some help to make it more comfortable, and I'm also referring you to a sleep specialist.
I hope that can make things better. The nights have been really tough.
We'll work on that. Regarding your emotional health, it's important to manage the PTSD symptoms that are resurfacing. I'm going to refer you to a behavioral health specialist who can provide one-on-one therapy. Consistent support is key in managing PTSD.
I think that'll really help. It's been tough dealing with these feelings on my own.
It's very understandable, and you're not alone in this. Now, for your dizziness and balance issues, we've conducted a neurological assessment today. Depending on the results, we might need to adjust your blood pressure medications, especially since you've had some low readings.
Yes, I've noticed that. Sometimes I feel a bit off after taking the medication.
We'll monitor that closely. If the low readings continue, reducing the dosage might be necessary. As for your overall energy levels and health, maintaining a balanced diet and staying hydrated is essential.
I didn't realize it could be affecting me like that. I'll switch to more water.
It's a good step. Also, we'll continue with routine lab tests to check the effects of these medication changes, especially on your kidney function and diabetes management. It's important to keep everything in check.
When do you need me to come back for a follow-up?
Let's schedule a follow-up in about 3 weeks. We'll review the lab results, see how you're doing with the CPAP machine and the medication adjustments, and make sure the referrals to the specialists are all set up.
That sounds like a plan. Thank you for making things clearer and setting all this up.
Of course, it's important to us that you feel supported and clear about your treatment plan. We'll see you back here in 3 weeks, but don't hesitate to call if you have any questions or concerns in the meantime.
I appreciate that, Doctor. I'll see you in a few weeks then.
Looking forward to it. Take care and remember, we're here to help every step of the way.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been managing my Grover's disease for quite some time now. It's mostly under control, but I do have days when the itch and discomfort are pretty bothersome. I've been using steroid creams occasionally when the spots flare up badly.
I see. And how often do you find yourself needing to use the creams?
It varies, but maybe a couple of times a month. When it's humid or I sweat a lot, it tends to flare up more, so I keep the creams handy. It's manageable, but I'm hoping there might be something more I can do to reduce the flares.
Understood. We can look into some other treatment options, possibly even light therapy if it's suitable for your case. Now, you mentioned a new issue with a tremor in your hands?
Yes, that's right. It started about 6 months ago. I first noticed it in my right hand when I was trying to drink my morning coffee, and it's been pretty consistent since then. It's not just in the mornings now. I see it throughout the day, especially when I try to hold something steady.
Is it affecting your daily activities?
Somewhat, yes. It's making it harder to do things that require a steady hand like writing or using tools. I've also noticed a slight tremor in my left hand, but it's not as pronounced as the right.
Does anyone in your family have a similar condition?
Not that I know of. It's just me as far as I'm aware.
Okay, we'll keep an eye on it and see how it progresses. How about your reflux symptoms? You mentioned they've gotten worse recently.
Oh yes, that's been quite troublesome. It usually happens after I eat, especially if I eat late in the evening. I end up with a bad acid taste in my mouth, and sometimes it's so uncomfortable that I have to get up and brush my teeth in the middle of the night.
Have you tried any treatments or modifications to your diet to help with the reflux?
I try not to eat late, but it doesn't always work out with my schedule. Other than that, no, I haven't tried anything specific.
We might start you on a trial of omeprazole to help control those symptoms. Let's also work on some lifestyle changes like avoiding certain foods that can trigger reflux.
That sounds good. I'll try anything to get some relief at this point.
Excellent. Let's also discuss your upcoming plans. You mentioned traveling to Florida.
Yes, I'll be there for a few months during the winter. I want to make sure I can manage my health while I'm away.
We'll make sure to set up a plan today so you're prepared. Moving on to your immunizations and screenings, we should talk about the shingles vaccine, especially considering your age and health history.
I've had reactions to flu shots in the past. They made me feel quite ill. Will the shingles vaccine be similar?
It's possible to experience some side effects, but they're generally mild and short-lived. We can discuss it in more detail to ensure you make an informed decision.
I appreciate that, and I'm due for a follow-up colonoscopy, right?
Yes, based on your previous screenings and age, it would be wise to schedule that soon. I'll arrange for your records from your last procedure to be reviewed as well.
That would be great, thank you. And what about the blood work?
We have your recent results here. Your cholesterol levels and metabolic panel are within normal limits, which is excellent. Your PSA level is also stable at 2.4 nanograms per milliliter, which is good news. I'd like to keep monitoring these annually, especially given your history and current medication regimen.
Sounds like a plan. It's good to know where things stand.
Absolutely. I'll summarize everything and go over the next steps. For your Grover's disease, we'll continue with the current treatment and consider a dermatological referral for light therapy. For the tremor, we'll monitor its progression and discuss further if it becomes more disruptive. We'll also schedule your colonoscopy. Any questions?
No, that covers everything. Thank you for taking the time to go through all this with me.
You're welcome. We'll see how these adjustments help and follow up in 5 months unless something urgent comes up. Safe travels to Florida.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, You'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello, I see you're here to discuss vaccinations. Which ones are you interested in or do you think you need today?
Hi, I'm not sure what I need. I'm planning a trip to South America and I just want to make sure I'm up to date.
For South America, you'll definitely need to be up to date on your routine vaccines like MMR and DTP. Additionally, hepatitis A and typhoid vaccinations are recommended because you can contract these through contaminated food or water.
Okay, I had my MMR booster a few years ago. What about yellow fever and malaria?
Yellow fever vaccination is necessary for most South American countries. It's not just a recommendation. Some countries require proof of vaccination for entry. For malaria, we'll provide you with a prescription for prophylactic medication.
That sounds good. Are there any side effects I should be aware of with these vaccinations?
Common side effects include soreness at the injection site, mild fever, and fatigue. It's normal, but if you experience anything severe, you should contact a healthcare provider immediately.
Now look at question 26.
Welcome, everyone. Today, I'm going to talk about emergency room triage, a critical process that ensures patients receive care based on the severity of their condition. Let's start with the basics. When a patient arrives in the ER, the first step is the triage process, where a nurse assesses their condition. Patients with life-threatening conditions like severe bleeding or heart attack are treated immediately. Patients with less urgent conditions will wait longer, which can sometimes be frustrating. However, it's important to understand that this system is designed to save lives by prioritizing the most critical cases. Now let's discuss the tools we use in triage. The most common is the Emergency Severity Index, which helps us quickly assess a patient's condition based on their symptoms and vital signs. Any questions so far?
Now look at question 27.
I have your X-ray results here. It looks like there is a small fracture in your right wrist. It's not displaced, which is good news, meaning the bones are still in alignment.
So, what does that mean for my recovery? Will I need surgery?
No, surgery won't be necessary for this kind of fracture. We will immobilize your wrist with a cast, which you'll need to keep on for about 6 weeks. You should have a full recovery with proper care.
Okay, that's relieving. What can I do to aid my recovery?
Keep your wrist elevated as much as possible to reduce swelling and pain. I'll also recommend some light exercises once the cast is off to help regain strength and flexibility.
Now look at question 28.
Today I'll be discussing pregnancy care, a key aspect of ensuring both maternal and infant health. Let's start with the first trimester, which is crucial for the proper development of your baby. During this period, prenatal vitamins, especially folic acid, are essential. They play a significant role in preventing birth defects. Also, regular checkups are crucial to monitor the health of you and your baby. Moving into the second and third trimesters, nutrition and exercise become even more important. A balanced diet and moderate exercise, as recommended by your healthcare provider, can help manage symptoms like back pain and fatigue. Lastly, let's talk about mental health. It's normal to experience a range of emotions during pregnancy. Seeking support from groups or professionals can be incredibly beneficial.
Now look at question 29.
Today, we'll explore strategies to assist you with daily activities, considering the challenges you've been facing. First, let's talk about scheduling. Organizing your day can significantly reduce stress.
I've tried that, but I still feel overwhelmed by tasks.
That's understandable. Let's incorporate some prioritization techniques. Focus on what must be done today and what can be deferred. Also, using tools like a calendar app can help manage your tasks more effectively.
What about physical activities? Sometimes I struggle with those.
For physical tasks, ergonomic tools can make a big difference. For example, a grabber tool can help you pick things up without bending. Also, consider breaking down tasks into smaller, more manageable steps.
Now look at question 30.
Welcome to our presentation on healthcare employees' fitness for work after an injury or illness. It's crucial for healthcare workers to return to work safely, ensuring they do not put themselves or patients at risk. The first step is a thorough assessment by a healthcare professional who will evaluate whether the employee can perform their job duties safely. This includes physical assessments and, if necessary, mental health evaluations. Once cleared, a gradual return may be necessary. This could mean starting with fewer hours or lighter duties and gradually increasing to regular duties as they regain full capacity. Finally, ongoing support is essential. Regular check-ins with a healthcare provider can ensure that the employee remains fit for their duties and address any emerging issues promptly.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
I'm Dr. Angela Chin, and today we'll delve into a pressing topic in cardiology: managing acute myocardial infarction complicated by cardiogenic shock. This condition remains a substantial challenge in emergency cardiovascular care due to its high mortality rates. Recent studies have provided us with new insights and management strategies, which we'll explore today. Firstly, let's clarify what we mean by acute myocardial infarction, or AMI, being complicated by cardiogenic shock. Cardiogenic shock occurs when the heart has been damaged to the point where it is unable to supply sufficient blood to the organs of the body. This severe complication affects about 5 to 10% of all acute myocardial infarction cases and is the leading cause of mortality associated with MI in hospitals. Mortality rates can be distressingly high, between 40 to 50%. Managing these patients is particularly challenging due to several factors. Most patients with AMI and cardiogenic shock present with multivessel coronary artery disease rather than isolated single-vessel disease, and this is associated with significantly higher mortality. Additionally, these patients often have pre-existing comorbidities, such as diabetes and hypertension, which complicate their management further. The evolution of management strategies for these patients is quite fascinating. The current gold standard for managing acute MI complicated by cardiogenic shock is emergency revascularization. This practice was largely influenced by the shock trial results published in 1999. This pivotal study showed that early revascularization significantly reduced mortality compared to initial medical stabilization, which includes the use of intra-aortic balloon pumps and other supportive therapies. Now let's consider a case study to illustrate these points. Imagine a 68-year-old male patient presenting with central crushing chest pain radiating down his left arm, accompanied by nausea and diaphoresis. This patient has classic risk factors: hypertension, poorly controlled type 2 diabetes, and high cholesterol. Upon arrival of the ambulance, his vitals show a blood pressure of 90/50 mm/Hg, a pulse of 88 beats per minute, and cold, clammy skin, a clinical presentation suggestive of cardiogenic shock. In the emergency department, an EKG confirms ST elevation in the anterior leads, and he is quickly taken to the cath lab for percutaneous coronary intervention, PCI. Here lies a critical decision point. Should the intervention target only the culprit lesion, or should it include other significantly stenosed vessels? Current evidence, including the recent culprit shock study, suggests that targeting only the culprit lesion with the option of staged revascularization of other lesions is associated with better outcomes compared to immediate multivessel PCI. This approach minimizes procedural time and complexity, potentially reducing complications in these critically ill patients. The culprit shock study has indeed provided compelling evidence that in patients with cardiogenic shock who have multivessel disease, culprit lesion-only PCI is preferable in the acute setting. The study found that this approach was associated with a significant reduction in the risk of death and renal replacement therapy at 30 days compared to immediate multivessel PCI. The management of AMI complicated by cardiogenic shock has evolved significantly over the years, largely driven by randomized clinical trials that have carefully examined various strategies. While immediate revascularization remains the cornerstone of treatment, the focus on culprit lesion-only PCI, supported by recent trials, marks a significant shift in practice. It's essential for healthcare professionals to stay updated on these advancements to optimize patient outcomes.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone. Today we focus on the complex and critically important topic of gastrointestinal hemorrhages, particularly esophageal varices and their management challenges. Today I will walk you through the intricacies of diagnosis, treatment options, and post-treatment care, including the management of associated complications, drawing upon recent research and our own clinical experiences. Let's discuss a recent case that illustrates the severity and urgent nature of managing esophageal varices. We encountered a 57-year-old male patient with a history of chronic alcohol use and diagnosed cirrhosis, who presented to the emergency department with episodes of hematemesis. His condition underscores the critical nature of early diagnosis and intervention. Upon arrival, his vital signs indicated hypotension with a blood pressure of 90/60 mmHg and a rapid heart rate of 102 beats per minute, signs indicating potential hypovolemic shock. Initial laboratory tests revealed a hemoglobin of 7.3 grams per deciliters, indicating significant blood loss, and his platelets were low at 60,000 per microliter. Importantly, his INR was elevated at 1.9, reflecting hepatic dysfunction and coagulopathy often seen in cirrhotic patients. Our immediate priority was to stabilize the patient hemodynamically. We initiated IV fluids and administered blood transfusions to manage his critical blood loss. Given his history and presentation, an urgent gastroscopy was performed, which confirmed the presence of bleeding esophageal varices. Treatment involved endoscopic band ligation, a procedure that effectively controls bleeding by mechanically compressing the varices. Additionally, we started the patient on a vasoactive agent, octreotide, to reduce portal vein pressure and minimize the risk of further bleeding. Post-procedure, the patient was transferred to the ICU for close monitoring. We initiated antibiotic prophylaxis with ceftriaxone to prevent infections, a common complication in cirrhotic patients following such acute events. Prophylactic antibiotics are crucial as they have been shown to significantly reduce the incidence of bacterial infections and improve survival outcomes in these patients. Now, discussing the long-term management, patients with esophageal varices require ongoing surveillance and treatment to prevent rebleeding, which is a common and life-threatening occurrence. According to guidelines and research studies, including those published in journals like the New England Journal of Medicine, beta blockers such as propranolol or nadolol are recommended to reduce portal hypertension and the risk of variceal rebleeding. In this case, our patient was started on nadolol upon stabilization. His follow-up care included regular endoscopies to monitor for the recurrence of varices and adjust treatment as necessary. This integrated approach, combining acute care interventions with long-term preventative strategies, is vital for improving patient outcomes in cases of gastrointestinal hemorrhage due to esophageal varices. This case exemplifies the need for a multidisciplinary approach involving gastroenterologists, hepatologists, and intensive care specialists. Managing esophageal varices is complex and requires a balance of immediate interventions and long-term management strategies to prevent complications and improve patient quality of life. The management of esophageal varices is a challenging aspect of gastroenterology that requires comprehensive understanding and an integrated care approach. Effective treatment not only focuses on immediate bleeding control, but also on preventing future episodes, managing portal hypertension, and addressing the underlying liver disease. Through continued research and clinical practice, we aim to refine these strategies to provide the best possible outcomes for our patients. Thank you for joining today's session. I hope this discussion has been enlightening and will enhance your clinical practices in managing such complex gastrointestinal conditions.